Survey day is exactly 8 weeks away. Right now, your complaints live in one folder, your risks are buried in a spreadsheet, and meeting minutes are lost somewhere in your email. PracticeCentred is built to consolidate this process. It brings your complaints, risk registers, governance meetings, and accreditation evidence out of those scattered locations and into a single workspace. When you log into the manager dashboard, the most critical metrics are at the top. You immediately see your open complaints, overdue risk reviews, and your overall accreditation readiness percentage. If a specific compliance item falls behind, it surfaces here first. You avoid cross-referencing 5 different systems to figure out what your team missed. Identifying these lagging indicators early means you can systematically close the gaps during normal working hours, eliminating the need to frantically assemble evidence at midnight before the surveyor arrives. Let's look at how this works in practice, starting with the complaints register. When an issue occurs, you log a new patient complaint directly in the platform. You enter the title, summary, severity, and receive date. Notice the explicit boundary on the form. You only enter metadata. It warns against entering any patient identifiers and tags the record as sensitive, so only authorized managers and owners can access it. Once received, you acknowledge the complaint, then manually create a linked follow-up task. This tracks the required fix like any other job in the practice, allowing you to attach supporting documents straight from your practice library. The structure is similar for the risk register. You log a new risk and assign it a category, whether it's clinical, operational, or workplace health and safety. As you input likelihood and impact, the risk matrix calculates a live rating from low to extreme. You then set mitigation actions and a review date. If that date slips past today, the system flags it as overdue, pushing a warning to a dashboard. Maintaining this centralized, time-stamped trail of resolved complaints and reviewed risks gives surveyors concrete proof that the practice actively tracks and manages its liabilities. Beyond tracking active risks, surveyors expect to see the overarching structural governance of your practice. We capture that starting with your governance meetings. When you schedule a meeting record, you input the attendees, summarize the agenda, and fill out the actions agreed field. It is important to note that the actions agreed field is strictly text only for your official minutes. If you need an actively tracked to-do item for your team, you create that task separately, keeping the meeting record intact as clean governance evidence. Next, we address operational contacts. Surveyors consistently ask who handles emergencies when the IT system goes down, making documented after-hours arrangements essential. You add your after-hours contact to the directory and flip this toggle to mark them as primary. Doing this immediately clears an operations gap on your readiness view. From there, you navigate to the settings menu to assign 3 specific governance roles: a risk lead, a complaints coordinator, and an emergency coordinator. Formalizing your primary contacts and explicitly naming your coordinators in the system systematically eliminates structural compliance gaps well before the survey period begins. Now we reach the module practice owners prioritize most, accreditation. It displays 5 readiness areas using a traffic light system, where amber and red mean work is required, and green means you're closing the gap. Executing the Apply Accreditation Pack action seeds your practice with default frameworks, like the RACGP 5th edition, and auto-generates document placeholders. Each framework then visually tracks your progress, showing how many items are complete against total required indicators. If you open the RACGP 5th edition framework, you can select a specific indicator, for example, infection prevention, and map your practice library policy directly to it. If an indicator requires a linked document, the system explicitly locks you out of selecting complete until that file is attached. You cannot generate a false green status with empty evidence. When you are ready for handover, you have 2 export options: a highly readable PDF summary or a comprehensive zip file containing all your linked evidence organized neatly by indicator. On the trial tier, these exports include watermarks, so you can preview the exact layout of the pack. On the Practice Plus tier, the exports are entirely unwatermarked and survey-ready. Forcing a strict mapping of physical documents to framework indicators transforms theoretical compliance into tangible proof you can confidently hand across a table. You should differentiate this export from your staff compliance audit pack. The audit pack handles credentials and staff records, whereas this evidence pack strictly maps framework indicators to your practice documents. Instead of resorting to midnight folder archaeology the week of your survey, you have a highly organized, tangible pack ready on demand. Note that the starter templates provided by PracticeCentred help you organize this evidence. They do not replace your organization's actual legal or accreditation obligations. See your accreditation gaps before survey day. Start your 30-day free trial at practicecentered.com.au.